Diabetes is a big problem, in particular since diabetes does represent a major risk factor for the development of atherosclerosis, which is the calcification of blood vessels, strokes and heart attacks. And diabetes has surged among American children, teens and adolescents. A recently published study over 20 years has found a 45% increase in type 1 diabetes, which is the juvenile type, and a 95% increase in type 2 or adult diabetes. The increasing prevalence of type 2 diabetes can be caused by the increasing rates of childhood obesity, but also in utero exposure to maternal obesity and maternal diabetes. Increasing rates of diabetes are always troubling, especially among the youth. High rates of diabetes have the potential to create a cascade of poor health outcomes. Compared to people who develop diabetes in adulthood, the young ones are more likely to develop diabetes complications at an earlier age and at higher risk of premature death, in particular because of cardiac involvement. Recent findings published in JAMA indicate that type 1 diabetes persists as the most common type of diabetes among the US young people, whether or not there is diabetes existence. That is usually done via blood tests. In addition to that, of course, we need to enforce a healthy lifestyle among our children, which means exercise, which means a balanced diet, and the reduction of calorie intake and the reduction of carbohydrates. If diabetes is diagnosed, however, then of course we need to be very aggressive with treatment, whether it's with oral anti-diabetic drugs or insulin. Often in type 1 or juvenile diabetes, they do require insulin. And then continuous monitoring of possible complications and consequences of the diabetes, in particular with regard to changes in the blood vessels. So there's a lot to do. Let's start now.